Welcome back, folks. Today we're going to be talking about urinary tract infections. That's right, the dreaded UTI. This is useful content. Why? Because most women will be affected by a UTI during their lifetime. The chances of getting a UTI kind of relates to age and probably how immunosuppressed you are. We know that as we get older, our immune systems don't function as well as they did when we were younger. But it also relates to certain risk factors like sexual activity. Now, UTIs can be a severe problem if it affects the kidneys or gets into the blood. If it affects the kidneys, that's called a pyelonephritis, and 250,000 cases of kidney infections or pyelonephritis occur every year in the United States, and 7% of those people wind up in the hospital. And some of those people are affected by something called urosepsis, which is life-threatening. A significant fraction of those people die as a consequence of it. So the purpose of today's video is to make you an informed patient. We're going to talk about causes of urinary tract infection, the ways to prevent urinary tract infection, how urinary tract infections are treated. So stay tuned. 3, 2. Right. So urinary tract infection, the doctor term for that is bacterial cystitis. Most cases of cystitis are caused by bacteria. It's possible it could be some other organism like a fungus, but it's very, very rare. So if you have a urinary tract infection, it's probably caused by a bacteria. And that bacteria is probably E. coli. Here it says 80% of urinary tract infections are caused by E. coli. That number may be even greater. It kind of depends who you ask and where you live. Klebsiella, Proteus, Enterobacter, other organisms that do cause urinary tract infections are more likely to occur in older people or people that have been hospitalized or catheterized, something like that. What you see here, this picture is a picture, well, it's a cartoon, of an E. coli bacteria. Here's one, here's another one, here's another one. And look at this. This looks like alien invasion. Look at these scary fronds coming off. These are called pili. Pili is Latin for hair. These are hair-like structures. And this is what the E. coli uses to attach to the inside of the bladder. You see there's a lining on the inside of the bladder. It's a mucous membrane. And some people's bladder linings are just stickier for E. coli than others. And that's why some people get bladder infections over and over and over again. You can't do anything about that in terms of your risk, but there are things you can do to, if you are at greater risk, to help prevent urinary tract infection. We're going to be talking about that today. Prevention is the best medicine. You know that already. So there's a whole bunch of symptoms associated with having a urinary tract infection, but there is one symptom that is most likely to be associated with a diagnosis of a urinary tract infection, and that is pain during urination. The doctor calls that dysuria. It means it burns when you pee. It's extremely uncomfortable. Now, there's a lot of other symptoms. I mentioned that, having to urinate more often, blood in the urine, back pain, having to urinate right away. That's called urgency, abdominal pain, fever, chills. All of these symptoms are associated with urinary tract infection, but are less predictive of the diagnosis of urinary tract infection. So, if you think you might have a urinary tract infection, but you don't have pain with urination, it makes it less likely. It could be something else. You still need to see a doctor and figure out what that something else is, but it may not be a urinary tract infection. So what do I do? Well, you got to see a healthcare provider. Now, your healthcare provider is going to take a look at you. That's the first thing doctors do when they walk in the room, is they say to themselves, how sick is this person? You say, sick or not sick? Is this person critically ill? Or is this person not critically ill? That's the first thing a doctor does when they take a look at a patient. Now, the doctor is going to want to examine you, may tap on your back to see if there's evidence of inflammation in the kidneys, indicative of a much more serious problem we talked about already called pyelonephritis. They're going to want to look at a urine specimen and ask you to pee in a cup to perform this incredible acrobatic maneuver called a clean catch. It's difficult to do for many people, but they need a urine specimen. Sometimes they'll collect it with a catheter. Some people just aren't able to collect a clean catch urine specimen. They're going to want to take a look at that. They may be able to do a dipstick right in the office. They may send it out to a lab. They may do both. If they send it to the lab, they're going to want to see something called a urine analysis. It's a chemical test of the urine looking for evidence of bladder infection. That is to say, are there white blood cells in the urine? Are there chemical indicators of inflammation like leukocyte esterase or nitrates? They may look at it under the microscope, see if there's red blood cells in the urine, and they may send it for a culture. Those are two separate tests. Now, I'm a big advocate of getting a culture. Some doctors don't do it, but I find it's very useful. If you get the urinalysis back and it does suggest urinary tract infection, you're not sure what bacteria may be causing it. Now, it's not necessary every time in every patient to get a urine culture, but it is often very helpful because with that culture comes a sensitivity profile. It tells the doctor which antibiotics are most likely to work against this particular bacteria. Now, some E. coli sensitive to some antibiotics, but resistant to others, so it can be very, very helpful. Again, the urinalysis and the urine culture are two separate tests. Often you need both. Your doctor's also going to want to talk to you about risk factors. They're going to want to know if you've had urinary tract infections in the past, if you've been hospitalized recently, if you've been catheterized. All of these things are important in helping your doctor understand how to approach this particular problem. So, what can you do to prevent a urinary tract infection? If you've had a urinary tract infection, I'm sure you're highly motivated to prevent getting another one. First thing on our list, D-mannose. This is a naturally occurring plant sugar. It's quite safe, even if you have diabetes. 1 to 2 grams a day is probably the right dose. Although it's over the counter, it's not an FDA-approved medication, and so the dose isn't clear, but that seems to be a reasonable place to start. How does D-mannose work? Well, one, D-mannose only prevents urinary tract infections caused by E. coli, but that's okay because most urinary tract infections are caused by E. coli. What D-mannose does is it binds these little hairs that exist on the alien invaders, and it keeps them from binding to the lining of the bladder. If you're one of those people that just genetically has kind of a sticky bladder lining, D-mannose might be a good thing to try. You can get it in health food stores. You can order on Amazon. So think about that. Hydration, 60 to 80 ounces of water a day. Not coffee, not tea, not alcohol, not soda, water. 60 to 80 ounces a day seems to be a reasonable target, provided you don't have an unusual lifestyle that would cause you to lose more water. For instance, I work with a lot of Pilates instructors, and if you're teaching several Pilates classes a day, yeah, you probably need to drink more water than that. But for us mortals that don't do that don't work out in the hot sun all day long, 60 to 80 ounces is a reasonable target. Keep track of that. Hygiene. Yes, I suppose, wiping front to back. But beyond that, I don't think there's a lot of evidence to say one way or another about other hygiene techniques. Avoiding baths is sometimes suggested, or patients sometimes ask about that. And again, there's not a lot of data on this, but we can use a little bit of reasoning to assess whether or not this is a practical thing to do. You see, the pressure in the urethra stays above the pressure in the bladder all the time, except when you're emptying your bladder. Then the pressure in the urethra relaxes and urine is able to escape. And then it tightens up again and keeps the urine in the bladder. Ideally, that's so. If you have urinary incontinence, that's a whole nother matter. Check out a different video. But avoiding baths for people that have a normal urethra, normal bladder function, I don't know. The amount that the urethra squeezes in excess of the pressure in the bladder is called the urethral closure pressure, and it's usually 20 to 40 centimeters of water. Centimeters of water is just a pressure measurement. Now, the depth of a bath, say it's 1 foot, that would be equal to 30 centimeters of water if the urethra is 1 foot underwater. And so it's kind of right in the middle of that normal range. If your urethra is a little bit on the weaker side, it might be possible for bath water to actually make its way through the urethra into the bladder. And so it's not totally unreasonable, and yet, it'd be something, maybe give it a try. If you're getting recurrent urinary tract infections and you're a bath taker, maybe try not doing that for a little while and see if it helps. Deeper water, really, I think reason suggests could contribute to a urinary tract infections insofar as water that you're in could make its way up the urethra into the bladder if the pressure exceeds the closure pressure of the urethra. Now everybody says, drink cranberry juice if you think you're getting a bladder infection, and that's true and that's not true, and here's the deal. If you go and you get sweetened cranberry juice, there really isn't much of the good stuff about cranberry in there, and there's a whole bunch of sugar. And cranberry itself, if you have kind of a sensitive bladder, can be a little irritating and might give you symptoms of frequency of urination, might irritate things more. What you want to do if you're going to try cranberry is getting that pure cranberry extract. You'll know you have the right one if it doesn't taste good. It's not sweet. That's the thing. It's a bitter product, and it may contain enough of the chemicals that cranberries have naturally in them that help you avoid getting a bladder infection. There also is some D-mannose in cranberry. Now you can buy cranberry tablets and extracts, other forms. Those might work as well. Keep in mind, D-mannose, cranberry, all these over-the-counter products aren't the FDA approved, so there isn't the same quality control as there is for medications that the FDA has put its stamp of approval on. And so, getting a high-quality product is really important and worth your time and research before you spend your money on such things. But cranberry extracts may be of benefit. I would probably start with the D-mannose, but it certainly could be added. And actually, there's a combination D-mannose cranberry product that comes in a capsule that you could take as well, if you are of mind to. Those are some good strategies for preventing urinary tract infection. So let's talk about treating urinary tract infections. The mainstay for treating a urinary tract infection is antibiotics, and there's just a whole slew of antibiotics your doctor has to choose from. Now, they have to make a judgment call. Based on your history, based on what they know about the kinds of bacteria that tend to cause urinary tract infections in their area, they're going to choose an antibiotic. But it's possible that you get a phone call 2 or 3 days later saying, oops, we picked the wrong one. Stop the one we prescribed, take this new antibiotic. And the reason that happens is because the culture and sensitivity test takes 2 to 3 days to come back. And so if that happens, stop the antibiotic that was originally prescribed, go fill the new one, start taking it, and take it until it's done. I know you already know that. But the thing is, once people start feeling better, they're like, well, I guess maybe I'll just save these in case I get another urinary tract infection. Don't do that, because it contributes to drug-resistant bacteria. And drug resistance is a big problem because it limits the number of antibiotics that are available to treat urinary tract infections. So you have to completely treat the infection. That's really important. A significant number of women that get a urinary tract infection will get another urinary tract infection within 6 months. It's like 25-30% of women who get a urinary tract infection get another one. And some people get them over and over and over and over again. It really becomes a terrible burden, and those patients need to be treated differently. There's a product called methanamine. It's been around forever and ever and ever. And it's a drug you take, and it gets converted actually to formaldehyde, which has antibiotic properties. And it actually seems to be pretty well tolerated and work pretty well. That's something that you might talk to your doctor about. Tends to be prescribed by urologists or urogynecologists more often. And you can always ask for a referral to a specialist if you're not getting satisfaction at the level of primary care. Suppressive antibiotics are sometimes used. That just means an antibiotic you take every day for a long time, maybe 3 months, 6 months, maybe longer. And the dose of a suppressive antibiotic regime tends to be lower than the dose you would use to treat an acute urinary tract infection. This can work very well, and sometimes after taking suppressive antibiotics for several months, you can stop it and you won't get further urinary tract infections. I don't know why that is, but it does seem to be the case. If you're pregnant, everything is different. You see, a urinary tract infection in a pregnant woman is more likely to make its way up the ureters to the kidneys. Those ureters are the tubes that drain urine from the kidneys into the bladder. And reflux of urine up the ureters to the kidney can make it possible for the infection that was in the bladder to establish itself in the kidneys. And it can make you really sick, really quick, wind up in the hospital. And if it gets into your blood, that's called sepsis, and you get really sick, possibly die as a consequence. So doctors tend to be much more cautious and more aggressive with therapy for pregnant women. That's what you need to know about treatment of urinary tract infections. I hope you have found this video informative. If you did, do me a favor, just hit the like button, hit the subscribe button, and leave a comment below. We look at all comments, and we will answer questions if they arise. Thanks very much. We're going to have more content for you shortly. Bye-bye.